cerebrospinal fluid. It will now enter the ventricle, the lateral ventricle. So once the lateral ventricle now is now full, it will now, move. It will move to the third ventricle through this foramen of Moron, and it will now move to the fourth ventricle through this aqueduct or cerebus or cerebral aqueduct. So if you now enters this fourth ventricle, it will now passes through this foramen of Lusca, the two of them. It will now pass and passes through this foramen of Mandelia to be stored in the subacrinal space. So from this acrinal space, it will now circulate. An opening, the central canal cord, and the cerebrospinal fluid now remaining will now go and nourish the inner part of the spinal cord, while the one in subacrinal space will nourish, it will circulate, passes through the sagittal suture and the sutures of the brain, to nourish the brain. That is everything about the circulation. I don't know if I'm rushing. Why the absorption now? The absorption, once it nourishes the brain and the spinal cord, it will now pass through and enter the acrinal granulation, which is very rich. They are rich capillaries. So it will now passes through the sinus of the brain and absorb and enter into the venous sinuses within the vas cerebri. See the vas cerebri here. This thing now passes through the vas cerebri, vas cerebellar, and tentorium cerebri to now enter the general circulation of the venous blood, where it will now enter the general circulation.